Welcome to the office.
Welcome to the office.
Thank you.
How can I
Glad
help
to be
you?
here.
Where are you coming from?
So, Virginia.
But
Moved-
you live here
But
now.
live here now for 3 weeks,
Okay.
basically.
All right.
Yeah,
You've been following me for a while,
I have.
and now
That's
you're
where
here.
I'm from. Yes, found you on YouTube.
And how can I help you? What's going on?
Probably about 25 years worth of back pain. Yeah.
What happened 25 years ago?
I think it was just a combination of different injuries.
Okay.
Well, I did fall down concrete steps in college and landed on my bottom, so I think there's an issue there with my tailbone.
So let's rewind a little bit.
Okay.
You're saying 25 years of back pain. What was your first major traumatic or trauma that you
Injury.
remember?
Probably the fall down the steps.
Down the steps.
That was in college, but I didn't have any issues from that until later.
Was that in sorority row, frat row?
It was just in a dorm.
Okay, all right.
Yeah.
And broke something?
Not that I was aware of then,
Okay.
but looking at my x-rays from a previous chiropractor, I noticed the tailbone was kind of wonky.
Okay.
But no one's ever noticed it before or said anything to me about that.
Well, we'll get into all that
Okay.
later. No problem when we go over your x-rays.
Okay.
So number one is low back.
Lower back, my neck stays stiff.
Okay.
Migraines. I have sinus issues. Deviated septum. Eustachian tube dysfunction. I have like water that kind of it feels like there's water. That's what my doctor told me.
Does it
before.
feel clogged?
It does.
Does it affect your hearing?
Probably, and I don't notice just because it's been that way for so long and I'm used to it.
Do you get lightheaded or
Yes.
dizzy when you're lying down and you sit up?
Yes,
How about from seated to standing?
sometimes.
More when you're lying down, so when you're waking up in the morning, it's taking you a little bit to get out of bed?
Yes.
Okay.
And I've had vertigo before. Not terribly, but like the past couple of weeks I had vertigo really bad when I woke up. And I don't know if that's related to that or if it was anxiety.
Or maybe a little bit of all.
Yeah.
Okay. So this eustachian tube in the ear was diagnosed when?
That's probably been a couple of years.
Okay.
But they just give me nasal spray. And
Okay.
you know,
Does it work?
not really.
But you still take it?
When it gets really stuffy, I have to.
And then it works?
Yes.
Okay.
But I have to continually do it
Every hour?
all day.
All day? Okay.
Yeah.
All right. Why are you looking at him?
Oh, I don't.
I'm over here.
I know.
I'm here. Okay. No stress her out.
No,
dude.
no, I'm
All
brother. I'm
don't-
brother.
Don't stress her out, dude. Okay. All right. Let's rewind. So
Okay.
number one is the back. Back pain. Is there shooting down your leg at all? Either leg?
No.
It's local.
Yes, but I do have hip pain, mainly in the left,
Left hip.
sometimes in the right.
Okay. When you're walking, standing, seated, lying down, doesn't matter.
Doesn't matter.
It's there all the time.
Yeah, more so when I wake up, it's like stiff.
Stiff. Stiff is different
Stiff.
from the pain, though.
Yeah.
It's two different things, and I'm going to explain what they
Okay.
are. Yeah.
Okay.
So you got that morning stiffness, so to
Yes.
speak. You
Joint
get
pain.
up, joint pain, and then you get up, you move around a little bit, you feel a little bit better.
I feel a little bit better,
Okay.
but it's always there. It's
Alright.
just chronic pain. It's always
Okay.
there.
And what's the answer? What were you told?
What's the answer? What have I been doing to manage it?
Well, what have you been told? You've obviously seen some people. 25 years of pain.
Massage.
Okay.
I've been given steroid injections for shoulder issues.
We're here first. We're here at the
Yes.
back.
Okay.
So in terms of the low back.
Oh, just another chiropractor,
Okay.
basically.
Did you go for an MRI or anything?
No.
Okay. Okay. All right. And you have previous x-rays that you had taken,
Yes.
and what was found and what was worked on?
They found that I had no curvature in my neck,
Okay.
compressed vertebrae,
Okay.
bone spurs
Okay.
in my neck and lower back.
All right.
So, yeah.
All right. Okay. Let's talk about the shoulders and the neck. Same thing, it's stiffness, right?
Yes.
You a little nervous right now?
Yeah.
Okay. Give me 5.
Can you tell?
Give me 5. No,
I'm
don't shake my
fidgeting.
hand, just
Oh.
slap it. Just go ahead, just give me 5. There you go, high five. You gotta break up that energy.
Okay.
That's it, okay. Listen, this is not supposed to be stress here.
Oh no, I know.
But
I'm just a nervous person.
Okay.
I know.
How's your wife?
Oh,
She's anxious too?
Yeah. For sure.
Okay, I'm just saying.
Runs the blood, brother.
So you're the balance, right?
Bro, I try to be.
Okay, all right. I'm just giving you
I
a
know.
hard time.
I know,
okay?
that's
Not
good.
a little bit. All right, so, all right, back, neck, shoulders, sinus, deviated septum, ears, TMJ. Okay. And
Migraines.
Migraines. And all of this means you are out of balance.
Out of balance. Yes.
And that's what we need to figure out today, right?
Right.
What's out of balance? Where are we going to start? You are local,
Mm-hmm.
so that's a blessing for both of
Yes.
us. So we're not having to rush everything in so fast. And let me rewind. It doesn't mean, you know, when they're local patients, the management is a little bit different. You know, when we have these traveling patients, we have a lot of traveling patients that come in,
Right.
and they're seen every day almost, or every other day, until they're here. As long as they're here, usually twice a day.
Well,
That's
yes.
not your case.
Right.
Okay. The only challenge for you is going to be number 1 to get to me,
Mm-hmm.
and to get your movements, and I will get you moving.
Okay.
All right. So our goal is going to be 10,000 steps. I want that in your head. You think you can't do it now?
I know.
You will.
Yeah, because I struggle with chronic fatigue also, and I struggled to get 5,000. Like
Okay.
after 5,000, I'm completely wiped out.
Okay. Why now?
Tired of being sick and tired?
Sick and tired of being sick and tired.
Yes.
Okay. Fair enough.
Yes.
All right. Is there anything else I need to know about you for today?
For today, that's enough for today, right?
Okay. What we'll do, let's go over your x-rays.
Okay.
Then we'll examine you and figure out where we're going to start.
Okay.
Along the way, if you're nervous or you really like Rahim, just stop.
Okay.
Okay? If you're uncomfortable with anything. Got it?
Yes.
If you don't understand something, you ask.
Okay.
I will make sure you understand what I'm actually going to do before I do it. Fair enough?
Sounds great.
All right, let's get started. You got a list here. What's this laundry
Yeah,
list?
no, that was just to make sure I didn't forget to tell you anything important. But
Okay.
I think we touched on all the key points.
You got your key points?
Yes.
All right, and you can always add down the road, okay?
Right.
All right?
Okay.
All right, let's do this.
Okay.
On the side profile, what we're looking at is posture, we're looking at curves, and we're looking at disc spaces to infer the alignment or the vertebrae responsible for what's going on. And then the A to P film tells us where to contact and how to correct it in this work. Now, when we're looking at your side profile, the first thing we can see here is very clear. We should have 60-degree reciprocating curves, okay?
Mm-hmm.
So we need a little more curve in that low back, but more importantly, your upper body is, the upper part of the building is sitting off to the foundation. It's supposed to line up. So what it's showing us is that your upper body is behind the foundation. So guess what? All these muscles and ligaments are tight.
Yes.
So just sitting for a period of time, everything starts to stiffen up, regardless. Okay, and we'll go over this in more detail later, but the goal is to get that posture right, get a little more curve in the back. I will go over good news, but that's later. I gotta give you all the stuff you came for
Okay.
first, okay?
Yeah.
Low back. First thing we want to look at is our foundation, and this is all about balance. Do we have a level base and foundation, and what's going on here? First thing I can see is we did have an old tailbone injury, yes. And you can see this is the coccyx, these pieces here. And something is going on right over here on this left side, okay?
Mm-hmm.
Something on this left side of the coccyx. Your hip sockets are good here. That's the good news. We're going to look at the numbers and see what do the numbers tell us. You have a rotated sacrum on the left side that's dropped 4 millimeters on that same side. That tells me also there was a tailbone injury or something is off in that sacrum. We also have a rotated pelvis on the same side. We have a 2 millimeter measured difference. 2 millimeters it's there, but it's not a lot, okay? Anything under 7 millimeters, normal variance adjustments will hold, okay? Everyone's designed differently. Some people want to be perfectly leveled, and it's a case I'm going to talk about later where we added a heel lift to someone who wanted to have more balance, more leveling of his hips. And as we started to level the hips with a heel lift because the adjustments weren't going to do it, he actually had more twisting in his spine. And so the goal is to at least keep it under 7, okay? And we'll talk about that case later. Now, 2 millimeters. If I adjust your pelvis, I will make it worse. So the answer is not your pelvis. The answer is your tailbone, your sacrum.
I've had my pelvis adjusted before.
That's not your answer, okay? Now, from there, what we can see, so number 1 is we got to get that sacrum up on that side. That sacral drop and L5 out a little bit is causing this curvature to the left side.
Okay.
And that curvature is creating more imbalance, right? So it starts to curve to the left, and then what's the body going to do? It's going to want to come back to neutral. And it actually curves all the way up to the middle of the back. Now, it starts to level off, and then what does it do? It starts to curve again. Right? And then the same thing in the neck. It starts to curve on the left side. Now here's what's interesting. Your upper cervical is compensation. Meaning what? If there's pressure there, we'll deal with it. But none of this upper cervical is going to hold without fixing the foundation straight. Okay? No ands, ifs, or buts. We have a right jaw deviation. We have a left jaw compensation. We have the deviated if it's on the outside where the cartilage connects to the bone. That I work on. People think I'm cracking the bone. I'm not.
Right.
You know, and I'm not going in there. We're working on this part right here.
Right.
Okay.
Right.
And you can feel it. It is there. All right. Does that make sense so far, ma'am?
Yes.
Okay. Cool. Digestion is a little bit off. We have a lot of undigested food going through the colon there. Here, let's look at your tailbone. And yes, we should have a smooth arc. And what do we see? We've got a nub here, but this is the coccyx open on the wedged on the outside right there. Sorry, right there. All right, so we'll probably need to work on that. We'll decide what's going to be the best for you today. Now, from there, what I want you to see is 5 and 4 are compensating. Okay, 5 and 4 compensate. 4, it's a very subtle, almost, I don't want to use that word. It's a different trauma. You had a couple in your back. You didn't have one. You had a few. All good. Let's look at the openings here. Look, these are the openings where the nerves come out.
Okay.
I can't even see this one. There's a lot of scar tissue in there. Okay? These discs are all good. So even though we're looking at these circle patterns, it looks like they're smaller than they really are. It's because they're tilted. There's an old compression injury. Again, I'm just pointing it out. Some calcification. But your discs are fine. These discs are all good. These discs are fantastic. Now, the interesting part here, your discs are great in your neck, but why is there, you had a whiplash injury?
Not that I'm aware of.
What are you talking about?
I don't know. I mean,
Do
I
you-
don't
does
ever
he need
remember.
Does he need to leave the room? Because look, your discs are all great here, but we have a little bit of that spurring, you want to call it. That's trying to fuse.
Right, that's what.
But from what? And if we look at the shape, look, those pieces are they're worn out. Like that was a whiplash movement. That was this, whatever it was. It doesn't just, unless you're like this all day.
No.
No. So whatever happened, something did happen. Look, this is the normal shape of the bone here.
Okay.
Look, it's like that corner is missing, corner's missing, corner's missing, corner's missing.
I can't imagine. I've never been in a car accident or anything like that.
Sports, anything? No?
Cheerleading, but that I don't remember anything happening.
Okay. Well, I'm just telling you what I see.
Okay.
Now, that's the overall picture, okay, of what's going on. That's the overall picture. Now, the take-home is this. We obviously need to work on this, and we need to work on the foundation. A lot of your low back pain is all compensation from whatever's happening in the foundation, number one. Number two, there could be there could be inflammation contributing it too from the digestion.
Yes.
Okay, and we'll talk about what we're
Yeah.
going to do for that as well.
Okay.
Okay. Then the area that controls if we're looking at digestion, it could be parasympathetic up in the vagus up top, or it could be down low. But the interesting thing is this. Here's what I need you to see. So you see it kind of straightens out here, and then it slightly curves this way, right? I'm exaggerating with my cursor.
Right, I can see it.
But then you can see C2 wedges hard on that left side, on the right side. Do you see that? So that's not going to hold without the lower stuff. But as I said, if there's pressure there, we'll deal with it. The upper cervical is wearing out a tiny bit, okay, the capsule, and the reason why is it's compensating. So there's a lot of crackling going on up there. And then you're forward and tilted. This is her. Okay, and then as soon as you try to straighten out, it's stiff and it pops and cracks for you to feel some relief.
Yeah.
Does that make sense?
Yes.
Yeah. Are you ready to change all that?
Yes.
Let's get started.
Okay.
All right, let's get started. First things first, let's watch you walk.
Okay.
And you're going to stand right here, and you're going to go back and forth several times. And Pastor, you ready to start?
Yes, sir.
All right, walk to the corner of the room and back several times. Turn around, whatever your normal walk is, just like you're giving me a high five. To the corner of the room, please. There you go. She walks kind of side to side, sideways.
Do I waddle?
A little bit. And then they can see your spine, and then it kind of, there's a line there, and then kind of disappears in the mid-back. Keep walking, please. Here, stop for a second. So first thing I want us to see here is little inflammation there, okay? We don't have good movement through the dimples this way. And then what do we see here? It curves like this, and then everything disappeared from here to here. And then there's a little dip, comes back, and then it does this, tilts, and then kinks like that. But she has to be mindful. She does that as a compensation. She normally just wants to hang out like that. So you sleep on your right side, ma'am? Or
I
your back?
sleep. No, it's either left or right. Never back.
How about stomach?
Sometimes.
Okay. Now, let's check your glutes. I want to show you guys something. Just hold there, please, on the side. I'm just showing the folds here, okay? So what we can see is left side is higher, right side is lower. We look from the top here. You can see the left side is flatter, the right side comes out, and that is consistent with the AS. It goes up. AS ilium goes up. It will raise the gluteal fold on that side. PI ilium will lower it. IN, so ASIN goes in, will cause a flattening of the gluteals. Now go ahead and walk one more time for me. There you go. Right knee is off too. We have to check the right knee. Keep going. And then she's a functional pronator, meaning she pronates more on the right side to compensate. Keep going, please. All right, let's get started. You ready? Have a seat, please. All right, let's see what we got going on. Starting at the base of the neck. So the textbook says 3 seconds per segment going up, from the cervical spine, 2 segments going down. So if there's 7 segments, it should take about at least 20 seconds. So guys, if we're just doing this stuff, this ain't doing nothing. So the initial scan is this: 1, 2, 3, 4, 5, 6, 8, 9, 10. See how it just shifted sides, but it didn't break. That was only 10 seconds too. Let's try that again. 2, 5, 6, 8, 9, 10. There it is. It's hiding at C3, C4. That's her anxiety. That's her shallow breath. Seriously. Tiny bit hiding up top, but we don't really want to mess with that. Or maybe we do. Occiput, C3, C4. Now from the thoracic, from here down, the book says 2 seconds a segment or inch. Different scopes, different sensitivities. Everybody has their thing. This is an art. There you go. Slow down. It's too much. Doo-doo. Breathe. Breathe. So as I went now, you see, it's not really there. Looks like it's going to be there. Nope. Doo-doo. That's crazy. It's hanging out on the left side. All the way down to the tailbone. Interesting. Down in the tailbone. I thought I had something here, but I don't. I have, let's try this one again. Okay. All right, let's feel what's going on. So here's what's going to be interesting in your case. This is a tailbone. There's a lot of stuff hiding out in here, okay? And let's go ahead and statically palpate. Static palpation, running our fingers down the spine. Let's look and see the swelling edema starts here in the mid upper back. Starts to go down. It didn't stop there. Keeps going, look, all the way down. All the way down, orange peel, all the way down, all the way down. All the way down, down to the tailbone.
That's inflammation all the way down?
Swelling and inflammation, yes. Now, it's like you know when you're at a seminar and we're at a seminar and then we have students hanging out and following us all the way around. So I want you guys to feel like you're right here with me in the room. So let's go ahead and feel what's going on. Feet together. Slide forward a little bit, please. Feet together. Open and close the knees with your feet touching. Open and close. Feet open and close. Open and close. Right side only. Good. Left side only. I mean, there's more fixation on this right side. Do you feel that, ma'am?
Yes.
More on the top, more at the bottom.
Top.
Yeah, that's with that PIEX. Now on this side, on the top or the bottom? Just pressure from my finger, right?
Yeah, I don't feel it as much on that side.
Now the fun part. Scoot back for me, please. I was saving the best for last. Okay, back slowly towards me. 5. Sorry, try that again. 5, 4. I know this is a little tender. 5 is a little tender.
Yes.
But now let's go in the
Yes.
sacrum. 1, sharp. 2, sharper.
Yep.
3.
Yep.
Keep going. 4. And 5.
Oh, yeah.
Now you can go from the front and see what she does. Let's try that again. L5, S1,
Ouch.
2, 3, Now I'm going down coccyx to 5. Right there.
Yeah, right there.
Coccyx to 5. Hi. How's it going? Well, that's
It's gonna
where-
be better.
It's gonna be a whole lot better. Sit back forward, please. Let's test the neck out. 7, 6, 5, 4, 3, 3, 2. That's not it. Up there. It's actually hiding out up top. Let's nod the occiput. Occipital bone primary motion of the occiput is nodding. Primary motion of the atlas is rotation. And let's go ahead and turn left, turn right. It's stuck because of that kink though. It's not stuck because of fixation. It's the kink and the scar tissue that's developed. Let's go ahead and nod the head. Good. Right side, left side. I'm gonna wait on that. I'm thinking we're starting in the tailbone, okay? We're gonna start in the tailbone today. I'm gonna have you walk.
Okay.
Then I'm gonna recheck everything,
Okay.
okay? Because all of this looks compensation right now.
Okay.
You're telling me there was no traumas that you remember. I believe you. But something happened.
Okay.
You don't sleepwalk? Sleep drive?
No. No.
None of that stuff?
Mm-mm.
Sure, okay, I'm just asking. You ready for me?
Yes.
Okay, let's get started. Bottom leg straight. You're gonna be okay.
Bottom leg straight.
Yeah, you ready for the new you?
I am.
You ready? Let's do it.
Ready.
You ready? What's tight?
This whole, like I could barely twist.
I don't want you to twist. I
Yeah.
want you to keep
Okay.
on your shoulder like that.
Okay.
We're gonna try to keep you as neutral as possible.
Okay.
And because we're down low, I'll be on the outside here, okay?
Okay.
You have underwear on?
No.
I will definitely be on the outside. Okay, so we want to be right there. Hold the wrist there. Come on over. Come on over. You can go a little wide if you want. I don't want you to get it. Good. There. Coccyx to S5. That's a piece. It's squishy. It's squishy.
Yeah.
Come up slowly, please. Let's walk it off. He's like, what just happened? Walk it off.
I felt it.
Yeah, walk it up. Check it out. Walk 2 times and we'll continue. Little different, huh?
Yeah.
Cool. Now, walk one more time, please. And we're going to go ahead and set the tailbone now. Let's go face down over here. You had that a long time.
Yes.
Yeah.
Long time.
There you go.
Okay, forgot how to do
You're going to put your hands right there.
Okay.
So, again, people think the coccyx and sacrum, it's one bone. It can't adjust, it can't cause pressure. When they fuse, right, they ossify, there's remnant disc there. The remnant disc can swell, and yes, it can cause pressure. All right. I'll be on the outside for the first one. Slide up a little more, please. That's it. Okay, just relax there, please. Now let's do that. receive. Palms up. Inspiration, inspire. Inspiration, breath is not the same as air or oxygen. You know that, right, sir? Completely different. I need you to breathe, not take in air. There it is.
Oh,
That's the
God.
home run. Gotcha.
Oh.
You ready? Wait for it. Hi.
Oh my gosh.
Gotcha.
Yeah.
Lock it up. Give it a minute. You're allowed to let it out. That's why you came. Tissue. The box, dude.
Oh.
Thank
Thank you.
Lock it up. Oh,
Wow.
wow.
Mhm.
What happened?
I feel lighter.
But did I hurt you?
No.
Why are you crying?
I mean, initially, but
I hurt you? It was a spicy adjustment, wasn't it?
it was spicy.
It was a little spicy.
It was spicy.
Walk it out. Hurt implies intent. There's no intent to hurt here.
Right.
It's just spicy. It lasts for like a second,
Yes.
right?
Right.
And it's done now.
Right.
And now look at you.
Feels great.
Yeah. You want to see something really cool,
Yeah.
just as a little thing? Sit on the floor against the wall, please. I want you to see something. Just sit
on
down.
the floor?
Yeah, just sit however you want to sit. Okay? So first of all, you can sit on the floor.
Oh, yeah. It doesn't hurt.
When was the last time you were sitting on the floor without pain?
Never.
Now stand up fast. Watch this.
See, I'm used to like,
Holding on to
Yes.
something? That was a lot easier for you.
yes.
Cool. Let's walk it off. Good stuff.
Good stuff.
Good stuff. That was the easy part. Okay, come back over here. Now let's see what else is going on there. Mira, check it out. Mm-hmm. Mm-hmm. Nada. It's just heat. I ain't touching the neck. That one, let's see. Doo-doo. Doo-doo. Mm-hmm. Oh, the B button. That one is there, T11, T10. All clear. Now, I do got some right there. Before I look at the upper, I want you to see something, okay? Right here, right here, right here, right here. Check it out. That's 5.
Wow.
That's 1. That's 2. That's 3. That's 4. Now you go check her out. 4 is pretty good, huh?
Mm-hmm.
Now let's go to 5, you remember?
Mm-hmm.
Now check this out. Come on.
Yeah, nothing.
Dun 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 dun.
Wow.
Limbo contest time. Look.
Yeah, it's amazing.
10.
Yeah, that's
10 is adrenals. You said there was what, chronic fatigue or
Yes.
fibromyalgia or something?
chronic fatigue.
Well, there's Probably adrenal fatigue. So let's go ahead and get that T10 set for you, okay? And now this one shouldn't be too bad. Maybe a little spicy. 12, 11, 10. Yeah, maybe a little spicy. Just a tiny bit.
Okay.
Come on over. Just a tiny
Keep the
bit.
tissues handy.
Yeah. Face down, please. There you go. All right. Sick and tired of being sick and tired. 4, 5, 6, 7, 8, 9, 10. Gotcha. Home run. Awesome. All right. That's the worst of it, okay?
Yeah.
Cool part is your neck is going to feel better as soon as you get up and start walking. And we didn't even have to touch it.
Awesome. Oh, really?
Check it out. We ain't touching it today. Watch. Get a little power on. Hopefully it's a little brighter now for you.
Wow.
What? Wow.
My neck doesn't feel as stiff.
Where's it coming from?
Tell them.
Have a seat. Now, go ahead and turn your head to the left all the way. Look to the left. Look to the right.
Wow.
Pretty cool. Look to the
Yes.
left. Look to the right. Sweet. All right. Lots of walking, okay? Shasha's
Okay.
going to have your homework for you.
Okay.
10 is clear. It's clear. Let's work on, you said something about your ear, right?
Left ear.
Left ear. I'll work on your jaw today for you.
Okay.
That one I'll do. But I'm going to mess with the ear on her on the first visit. There's a reason.
Okay.
Because she's telling me eustachian tube, there is connection to TMJ.
Oh,
All right, so I'm
Yes.
going to work on TMJ. We'll see what happens first.
okay.
It's not just pa 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 and then start cracking everything.
Right.
Setting. As much as I want to pull them straight. Look up. Slowly open. Open, open. There's that right deviation, left compensation. Okay, let's get the condyle block. Do-do, do-do, do-do. Where my condyle? There we go. Condyle block. This is cervical condyle block. We'll use it to stabilize the cervical spine so there's no movement of it when we're working on the TMJ. Go ahead and we're going to work on the left EX side first. And you said it's the left ear, right?
Mm-hmm.
Okay. So the left EX, this is the only time in the Gonstead work you do the compensation before the true subluxation. Open all the way, close half only, and hold right there. Open all the way, close half, hold. There it goes.
Oh my
Nice.
gosh.
Nice.
Oof.
Slowly open. It's not compensating now as much. Open. A little bit less. Good.
Mm-hmm.
Close. Open all the way. Open, 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 open. Close half. Hold. There you go. Gotcha. Holy moly.
Holy moly.
Holy moly. Okay. Deviated septum on your back here. On your back. You know why I'm working on your TMJ and septum today?
Why? Why are you?
Because your neck was clear.
Oh, really?
It's not your neck. It may show up, a lot of it is compensation, it may show up along the way. The neck wasn't the cause. Chin down. Yes, you have a question.
Is it going to be spicy?
Not for me.
Okay.
I already had my achar this morning.
Okay.
You had the worst of it.
Yeah.
It's not going to be any worse than anything else. And even if it is, does it matter
It
at this
doesn't.
point?
I know. I'm
You
just,
know? No, it's not. You're smiling already. That's good. Chin down. It's right there. You feel this right there? Not as bad there. So we're going to do these. Deviated septum adjustment. Chin down. There you go. Oh, gotcha. Deep breath. Voila. Deep breath. Voila. Okay, walk off that nose job.
I'm going to look different, aren't I?
You're going to smile, so definitely you look different. You're going to feel lighter, so you're going to be, look at that.
That's good.
One more time, please. Good. Have a seat. Actually, I'm sorry. I need to open the back of your gown. I'm sorry. So we need something to compare before and after.
Okay.
Not just that, oh my God, I feel good. Walk to the corner of the room and back, please. Definitely smoother. Have a seat. And let's work on the shoulders. Right shoulder. Let it go. Let me have it.
I'm sorry.
That's all right. That's it. And on your back, we'll work on your ankles. Speeder board. Use the speeder board to go a little bit quicker in the adjustment, less traumatic to the patient. And yes, the sound is the board, yes. That hurts, yes. Oh my gosh. We got work to do on that. I'm gonna get it started right now. AS talus, medial tilt. AS talus, medial. AS talus, medial tilt. There you go. All right. A little tender in the back there, right there. Just a little light sit on the posterior tib. And then I'll give you homework. There you go. Okay, walk it off 2 more times, please. Let's put that sock on. Check it out. Come stand over here. Squeeze.
I'm trying.
You're doing great.
Okay.
Squeeze. You're doing great.
Okay.
A little bit on the elbow. Thumb. Squeeze. Questions for today? Okay, all of this was compensation from an old tailbone injury. We started on Coccyx sacrum and T10 today. We worked on TMJ, we worked on deviated septum. Things will shift around. Your homework is going to be very simple. Walk as much as you can. I would say 10-minute increments for you.
Okay.
Okay, 10-minute increments, don't
Okay.
overdo it.
Okay.
Icing the areas that I adjusted. Steaming, very important to start draining.
Okay.
Okay. I like old school. Boil a pot of water, cover yourself with the sheet, no shirt, okay, and just let it steam out, okay, as much as you can.
Okay.
Today is Monday. We will regroup either Wednesday, if you already have your appointments booked?
Saturday.
Saturday, okay, well then I guess I'll see you Saturday.
Okay.
You have any questions for me?
Would you recommend massage between
No.
them? Okay, don't do that.
You don't need it.
Okay.
You were getting it because your muscles were
was.
tight from imbalance.
Okay.
Now, if you want to go get a nice oil effleurage, Swedish massage, just because you want to feel good, that's fine.
Okay.
But you're not doing it for, you know what? No,
Don't do it. Okay.
just walk.
Okay.
Ice, walk. Shasha will give you an anti-inflammatory grocery list to eat from.
Okay.
Okay? Very
Sounds
simple.
great.
I don't tell you how to cook your foods. Just follow the list and the portions that it says. You have a lot of options. Meat options are there. And obviously you're going to minimize or eliminate gluten and dairy for a few weeks.
I have already.
Then we're halfway there.
Yeah.
Welcome to the office.
Thank you.
You're very welcome.